Fox News alert, and the Speaker of the House, Nancy Pelosi of California, says she does not have the votes to pass the Senate version of the health care bill. It gets a little bit complicated, but there have been discussions of this possibility. The House would perhaps pass the bill that has already passed in the Senate, and then it would be signed into law by the President. Then, using a process called reconciliation, which is really a budget process, the Senate would go back and sort of tweak the bill. If they did it that way, Democrats in the Senate would not need the 60 votes that they currently need. They would only need a majority vote, simple majority of 51 votes. It would be a way to escape the complications that have been raised by the election of a Republican, Scott Brown of Massachusetts, to Democrat Senator Ted Kennedy's former seat. At any rate, Nancy Pelosi says not going to happen. She doesn't have the votes in the House.
Many of you have asked many questions about where we go from here. Let me congratulate the new senator, Senator Brown from Massachusetts. While the results of the Massachusetts election may have diminished by one the number of senators in the Senate. Last year, this time, there were 58 senators, I remind you, 58 Democratic senators. Now there are 59, and we are meeting with our members on as a caucus in different groups of the caucus to hear how they perceive the best way to go, how they would prefer to go forward.
Committee. Senator DeConcini, to you first. Does this surprise you? Nancy Pelosi seems to be throwing in the towel on passing the Senate bill.
Well, yes, it doesn't surprise me. The House had some real strong objections. I've been in touch with a number of House members to the Senate bill, and I'm not surprised. And I don't think it'd be a good idea for the Democrats to try to do that, because it would be interpreted as a in-run, skirting the people's will of the recent election. And Scott, you do have the rules down very good. Congratulations.
Well, what happened is the American people rose up. They were riled up. They were stirred up. They didn't like the higher taxes, the dictates, the unfunded mandates on the states, as well as higher premiums. And so you saw it in Virginia. You saw it in New Jersey. Clearly, a message was sent from Massachusetts. And what the American people want is actually an opportunity to have more affordable, personal, and portable insurance rather than dictates and mandates from the federal government and higher premiums. And so when they're in this falderall trying to figure out what to do, what they have in this monstrous health care measure of the government takeover is like a bad stew. And they're trying to figure out, gosh, if we take out one of the carrots here and put in some parsnips or some celery or some turnips, it is rancid. It's a rancid stew. It needs to be dumped out, and they need to start over again with ideas that empower individuals as opposed to having them dependent on a government and spending trillions of dollars that we don't have and adding to our burgeoning deficit.